Psoriatic arthritis, a chronic immune-mediated disease, affects approximately 20 to 30% of patients with psoriasis. Randomized controlled trials have demonstrated efficacy and safety of biologics in psoriatic arthritis, but they do not adequately represent patients in clinical practice. Hence, real-world data comparing biologics, particularly over the long term, are needed. PsABio was a prospective, observational, real-world study of patients with psoriatic arthritis who were prescribed either first, second, or third-line ustekinumab, or a tumour necrosis factor inhibitor, also known as a TNFi. The PsABio study aimed to generate real-world data for physicians making evidence-based treatment decisions in clinical practice. Drug persistence, effectiveness, and safety of ustekinumab versus TNFi treatment were the primary assessments carried out every 6 months. Overall persistence and persistence within subgroups was assessed by propensity score-adjusted comparisons with hazard ratios for stopping or switching initial treatment. Effectiveness was assessed by achievement of remission using the Clinical Disease Activity Index for psoriatic arthritis, also known as CDAPSA, measure of low disease activity, also known as LDA, and achievement of minimal disease activity, also known as MDA, or very low disease activity, also known as VLDA. In the final analysis set, there was a total of 893 patients, of which 438 were receiving ustekinumab and 455 were receiving a TNFi. With regards to baseline characteristics compared with patients in the TNFi group, those in the ustekinumab group were older, had a longer duration of psoriatic arthritis, had more severe skin disease, had more chronic widespread pain, and had more patients receiving their respective therapy as third-line treatment. Propensity score adjusted hazard ratios demonstrated comparable overall persistence between the treatment groups. Patients in the ustekinumab group were 0.82 times more likely to stop or switch their initial treatment compared with patients in the TNFi group, the confidence interval being 0.60 to 1.13. Persistence on ustekinumab and TNFi treatment was similar at 1 year, with 72.4% of ustekinumab and 70.5% of TNFi-treated patients remaining on their initial treatment. In the subgroup analysis, better drug persistence was observed for men compared with women, those receiving ustekinumab as monotherapy without methotrexate compared to those receiving TNFi as monotherapy, those receiving first or second-line treatment compared with those on third-line treatment, although this was prominent for patients on TNFi, and patients with more skin involvement, although this was mainly for patients on ustekinumab. Of note, for patients with the greatest skin involvement, defined as body surface area higher than or equal to 10%, persistence with ustekinumab was greater than with TNFi. Propensity score adjusted odds ratios did not reveal a difference in effectiveness between ustekinumab and TNFi treatment groups. CDAPSA LDA was achieved by 55.9% of patients in the ustekinumab group versus 67.1% in the TNFi group. The propensity score adjusted odds ratio was 0.80, the confidence interval being 0.57 to 1.10. CDAPSA remission was achieved by 22.1% of patients in the ustekinumab group versus 31.7% in the TNFi group. The propensity score-adjusted odds ratio was 0.73, the confidence interval being 0.49 to 1.07. MDA was achieved by 34.2% of patients in the ustekinumab group versus 43.1% in the TNFi group. The propensity score adjusted odds ratio was 0.89, the confidence interval being 0.63 to 1.26. The safety profiles of ustekinumab and TNFi were similar in the study. In conclusion, real-world results from the PsABio study have demonstrated generally comparable overall drug persistence, efficacy and safety following 1 year of treatment with ustekinumab or a TNFi for psoriatic arthritis.